Michelle, and I'm a social worker with Rush Generations. Today I will be talking about fall prevention, and I actually wanted to start off by saying that Governor Pritzker, he announced from September 20th to September 24th would be Fall Prevention Awareness Week. And I actually wanted to read that proclamation with you today because I just think it's incredible. So the proclamation states, "Whereas we must develop a society where all people, including our older citizens, can live in their full potential, and whereas older adults are as the fastest growing segment of our population, with more than 1.5 million persons in Illinois being 65 years or older, and whereas at least 1 in 4 Illinois residents over the age 65 will fall each year, potentially limiting their ability to live full and active lives. And whereas falls are the leading cause of both fatal and non-fatal injuries for people ages 65 and older, every 14 seconds an older adult is seen in the emergency department for a fall-related injury. And whereas falling and the fear of falling can lead to depression, loss of mobility, and loss of functional independence in older adults. And whereas effective fall prevention strategies, including comprehensive clinical assessment, exercise programs to improve balance and strength, and medication management, and working with healthcare professionals to reduce fall hazards and increase safety with valued activities in and around the home. And whereas older adults should not be alone in their efforts to reduce fall risk, and healthcare professionals, family members, friends, and community resources can provide the support needed to safely live lives to the fullest." So Governor Pritzker proclaimed that September 20th to September 24th, 2001 would be Older Adult Fall Prevention Awareness Week in Illinois. And he called upon all residents, including healthcare professionals, family members, and caregivers, to observe the day and become familiar with the risk factors for falling among older adults, and implemented fall risk reduction strategies to reduce older adults' risks of falling, adding years to their lives and maintaining their quality of life and independence. And I just think that's great. So I'm definitely glad that I am talking about this topic with you all today, and I can share just a little bit on what we can do to prevent falls in ourselves. I also just want to say it's really important that we talk about falls, because 1 out of 5 falls, it does cause a serious injury. These injuries can make it hard for a person to get around, do everyday activities, or even live on their own. As falls can be a risk for any age, they can be a higher risk, and they are a higher risk and threat to the health of older adults by potentially reducing their ability to be independent. Every year, approximately 3.7 million Americans turn 65, and as this segment of population grows, so does the number of people who are more susceptible to falling and having falling-related injuries and deaths. And some injuries as a result of falling can include broken bones, fractures, and head injuries. And it's really important that even if you fall and you don't get injured, you want to let your healthcare provider or doctor know. Especially if you do hit your head, you'll want to check with your doctor right away to make sure that you don't have like a brain injury. Many people who do fall, even if they don't have an injury resulting in that fall, they become afraid of falling, and the fear can make a person want to cut down their everyday activities. And when a person cuts down their everyday activities and become less active, they actually start to become more weaker, and that actually increases your chance of falling. There are some conditions that make it more likely to fall, and that's like lower body weakness, vitamin D deficiency, difficulties with your walking and balance, using medications such as like sedatives, tranquilizers, antidepressants, if you have vision problems, foot pain, or just poor footwear in general. And then home hazards, so that can just be like an uneven or broken surface or steps, if you have a throw rug, or if you have clutter and that you can trip over, especially in the walkways, if you don't have handrails alongside the stairwell, or even a grab bar in the bathroom. But the good thing is that many of these conditions can be modified to reduce your risk of falling. And actually, when you combine several of those risk factors together, you actually are in a more increased chance of falling. So everyone has a role in preventing older adults from falling, including the community health providers, caregivers, and older adults themselves. And my role today is to just give you more information about how you can protect yourself from falling. So we've been talking about falling this whole time, so what can you really do to reduce the risk of falling? Now there's some risk factors out there that are out of your control, but there are several things that you can do and you can control starting today. You can attend your medical appointments. You can talk to your doctor about any concerns that you may have. You can start removing clutter around the home, making a clear walkway, especially from your everyday paths that you do. You can secure any loose rails. You want to remove any electrical cords in the walk path. Fix any uneven walkways or securing loose rugs. You want to add a grab bar to your shower or near your toilet, and maybe even having a life alert system that can protect you, especially if you're alone. And just in general, you want to stay more active and continue moving. Yoga and Tai Chi is found to be a good form of exercise. We actually have those evidence-based programs at Rush, such as Matter of Balance and Tai Chi, and it actually is a class that you can take and it can help you reduce your risk of falls. But overall, we want you to get connected with a trusted healthcare provider, and if you need assistance doing so or would like to participate in one of Rush's class, you can definitely give us a call at our 800 line and we can sign you up for a class to help you reduce your risk of falling today. Thank you so much, and I'm so glad I was able to present you this mini clip, and you have a wonderful day.